In 2016, McLeod was voluntold that they were going to be part of the mandatory bundle for hip and knee replacement. That initiated us to look at, okay, how are we going to thrive and profit in a bundle payment, and what are our challenges and what do we have to work on? That's what really started to push us to, okay, we need a comprehensive program to look at all aspects of the program, looking at supply chain, looking at implants, looking at clinical pathways, looking at pre and post-operative care, looking at what happens after the patient leaves our door. The margins now are very tight, and especially under the bundle care, or if it's a Medicare patient, it's very tight. We initiated a RFP for total joints. We narrowed it to 2 vendors, but the way we did that is we had every physician come to meetings. We had supply chain there, and the first part was just education. One of the toughest points was being fully transparent on everything. Just getting the data and getting the numbers and being comfortable to share those numbers. One of the surprising things is how difficult it was to get all the data that we needed. Unfortunately, some data is in one computer system for supply chain, some data is in another system for RCM, revenue management, another one in for what we actually do for the medical record. And accumulating that data took some time, but we wanted a dashboard that we could look at, and that would integrate utilization, costs, revenue, and outcomes. And the last thing we wanted to do was implement a change in vendor or a change in product that was detrimental to our patients, no matter what the cost is. That was off the table. SupplyCopia came and said, well, if we were going to develop a dashboard for you, what things do you want to see on it, and what data points do you want to monitor and follow, and how can we do that? And obviously we wanted to look at by physician utilization. The average cost per hip replacement is X. The average cost per knee replacement's Y. We wanted to look at complications, readmissions, infections, all that, and we kind of came up with an aggregate scoring system, 1 to 10, 10 being perfect score, everything looks great, and going down, and each physician knows their score, and we know each other's scores. And you can see if there's any outliers. And if you're on the left of the curve, it should stimulate conversation to say, okay, what am I doing different? And what is the guy on the right of the curve doing that I'm not to make it? And then going forward, the other question is now, once we get this baseline of a dashboard, is can we utilize it to test hypotheses or test changes? So we know what our baseline is. And now if we say, okay, we're going to switch to vendor X and use their products because they've come back to the table and given us a better price, does that affect any of our outcomes or results? Or we're going to implement a new technology, computer navigation, robotics, etc. How does that affect our cost structure and our outcomes? And is it detrimental? And then does that added expense actually result in a significant better outcome for the patient? All the physicians went through like their surgery pack. Some of us had all these extra stuff, and do we use it all the time? No, but it's in there in case we need it. We try to standardize that the total knee pack contains all this, and that will cover 85 to 90% of cases. We noticed that there was charge capture being missed. At one of our facilities, we noticed that 28% of the time, the knee replacements weren't having the 3 main components of a knee. It triggered us to say, let's go dig deeper into this. And it was just not being captured. Now we captured it, so that would, increase revenue. We've standardized a lot of processes. We've all agreed, we looked at different steps of the process, or, should we use this medication? Yes or no? Should we, use a CPM machine after surgery? Yes or no? Should we, do this antibiotic versus this antibiotic, and we went and found the best data and evidence to say we think it should be this and everybody should do this. And pretty much we have about a 95% compliance rate with those processes. The other thing that was enlightening to me is that you can have death by data. You can have too much data that just overwhelms you, and you need to focus and say, okay, we're going to focus on these 1 or 2 items and work on that, and then focus on the next 1 or 2 items. I think the other step is getting everybody comfortable. I want to have all our physicians be able to at any time click on the SupplyCopia dashboard and look at it together, or by themselves. Here I am, here's Dr. Denton, here's what's going on. We're at that stage now where everything's about as clean as we can get it. And I think the challenges for us and SupplyCopia was, like I said, just data mining 4 or 5 different systems and trying to get it all together. I think the biggest enlightenment to us was being able to have full transparency. Having full transparency is critical to increasing the value of a service line or a procedure. I still think there's all these, falsehoods that are in everybody's minds of what it really costs and what you really get paid and how it works, and educating everybody on that. It was very enlightening to me. The CEO of our system came and said, I'm 100% on board. I want this to work. You guys have full access to anything if you don't get it, you call me. Seeing that, from the top to the bottom was at the table and involved was very important. I think, there wasn't anybody that, couldn't come to the meeting or sit at the meeting or present data or ask questions. I've seen some change in our organization, and I think that's the future of medicine.